Hello, my name is John Brown. I'm Head of Development and Impact at the NSPCC. As part of our focus on preventing child sexual abuse, I'm delighted to have with me today Professor Richard Wortley from the Dando Institute. Richard, could you tell us a bit about the Dando Institute and your interest in this area of preventing child sexual abuse?
Sure. Well, the Dando Institute at UCL is an institute that's devoted specifically to the problem of preventing crime before it starts. In terms of prevention, there's been very little about primary prevention. In other words, trying to stop child sexual abuse before it occurs. A lot of what we've been doing has been to work with offenders once they're caught. The place-based approach that we adopt at UCL recognises that for any crime to occur, including child sexual abuse, you need actually three things. You need an offender, and you certainly need to be able to do things with the offender. You also need a victim, and you also need a location for where that offence takes place. And so our work is about how can we intervene in those other areas as well to increase safety. So we broadly call that a place-based approach where our aim is to create safe locations for children.
Can you tell us a bit more about that and what's termed situational prevention?
Right. Situational prevention is about looking at the places where potential offenders and potential victims, children, congregate or come together and trying to examine the areas of vulnerability there and trying to reduce those. There are hot places and hot times. And if we examine those places and times, it can give us really good information about what makes those places vulnerable. What we've learned and need to recognise is that the potential to perpetrate child sexual abuse extends much further back into the normal curve than it's comfortable for us to think about. And we know that when we look at who the offenders are and the relationship between offenders and victims. We know that in most cases, the majority of cases, offenders and victims have pre-existing relationships before the abuse occurs.
What more preventative work do you think can be done that we think does work with children and families to prevent the opportunity of them being targeted and abused?
So the parent does have a capacity to develop or learn to apply more effective guardianship strategies with their child. And that's probably one of the only ways that we can get into the family home to make that a safer place for people.
Can you talk a bit more about what a public health approach to sexual abuse prevention means?
Victims, how we can provide better guardianship for potential victims. We need to think about how we can make the places safer.
And of course, Richard, we all have a role to play in the prevention of child sexual abuse, whether we are family members, parents, professionals and government as well. Child abuse is everyone's issue and everyone's concern, and everyone can be involved in its prevention.